The title of my talk is, It's About Time. It's About People. These are my reflections on some enduring issues, some current challenges, and future prospects for SRHR in the post-2015 development agenda. At the outset, I'd like to give my appreciation to the conference organizers, supportive UNFPA colleagues, and our great sexual and reproductive health and rights community for the opportunity to speak at this important conference. It is truly a pleasure to be present in front of such an engaged community of advocates, activists, service providers, policymakers, both inside and outside of government, and people from the donor community. Our work in sexual and reproductive health and rights is always a challenge, and it's only through our collective efforts that we've been able to achieve as much as we have and have such a deep awareness of what remains to be done. I am uncharacteristically, for me, reading this thing because I honor this occasion. I generally just speak off the cuff. Forgive me for any difficulties that reading causes. You'll hear me talking extemporaneously during questions and answers. I'm hoping to provide this morning some highly personal, need I say, idiosyncratic reflections, which I hope are some value to you in your work, particularly those of you who are engaged in policy and have to interact with policymakers. I'm listed on this panel as a member of the development program community. I'm retired from formal membership, but I remain active and, as possible, engaged with the development community. Some of my perspective is shaped by the fact that I worked for MDG 5B from the vantage point of the UN Millennium project, which was a creation of the Secretary General and the team led by his advisor, the continual advisor to the Secretary General, Jeffrey Sachs. This approach put me in contact with others seeking to advance their causes in multiple sectors of activity, which was truly an eye-opener in many ways. As a community, we know each other and interact with each other very well. But the opportunity to see people pushing for different sectoral concerns and different issues across a wide range of issues really gives some perspective about what the true nature of the challenges are and what the task before us is. I come to you more with reflections than advice. I've never been seriously accused of being practical. As I will discuss later, it's a measure of the maturity of our efforts that many of the presentations that are being made during this conference are practical reports of lessons learned, good practices, needs for programmatic scale-up. We are slowly, as a community, perhaps too slowly, learning to do more rigorous research that can convince skeptics about impacts and causes, and this is indeed a value. In this context, what I will offer you is some thoughts about our effort, a kind of good news, bad news assessment of the lay of the land. This meeting is taking place at a very important time. We're nearing the deliberations of the Commission on Population and Development, whatever shape its outcomes take. The late portion of one stage of the deliberations of the open working group that is planning the post-2015 development agenda, and the final run-up to the review of the implementation of the ICPD program of action. We've all been running ourselves ragged to ensure that SRHR gets prioritized placement in the MDG successor. But progress has been accompanied by uncertainty and can be undone without constant vigilance. What's the good, or perhaps the best news? It's that the enduring version of a person-centered and rights-based development that was embodied in the ICPD program of action has taken hold. In a sense, we've won the war, even as we fight our many battles. The post-2015 agenda has highlighted issues of rights, with appropriate priority to women's rights, personal dignity, and inequality and exclusion as key concerns in a way that the MDGs did not. SRHR advocacy has been featured in thematic discussions of various kinds that have been undertaken in the UN system, including health, population dynamics, inequality, and governance, to an extent that was never anticipated by the people who organized these discussions. It's a testament to NGO efforts in the opportunities that these processes have allowed that we must carry forward to the final completion of the definition of the post-2015 agenda before its launch in 2015. But we must recognize that discussions within our community still don't resonate with other interest groups' discussions to the extent that we would desire. Even the very concept of reproductive health has not been fully internalized by many other would-be and should-be partners in the UN and outside. Conceived of an ICPD as an overarching rubric encompassing family planning, safe childhood and maternal and child survival, sexual health, HIV/AIDS prevention, use of data for policy planning and implementation, we've sold the parts, but not the overall framework. In 2000 to 2007, we actually had to settle for what was practical. And we got universal access to reproductive health included as a target under maternal health. Unfortunately, it was the only opportunity. Maternal health, not just women's health or health at writ large. The expanded vision remains unfinished business that will always need attention. We can only work to avoid such marginalizing characterizations in the framework to come, and in any remediation efforts that may be required afterward, just as we had to fight afterward to get into the MDGs. And whatever policy framework, the policy environment the new framework provides, we will, of course, work to make the exercise of rights and universal access to information and services a reality on the ground. Part of the problem is that our larger vision cuts across disciplinary boundaries and specializations, affecting health and capabilities at different stages in the life cycle, requiring different approaches depending on local situations, attended by different fields of analysis and dialogues and discourses, economics, anthropology, sociology, theology, the list goes on and on. This inhibits communication, even among people of goodwill and similar understandings across a variety of such subspecialties. We also have our own internal division as we fight amongst ourselves for priorities on parts of our agenda that are of particular interest to us. And in touch with lived reality's view of a life cycle approach offers a stepping stone to progress and is part of the emerging discussion. But this is often being forced these days under a rubric of universal health coverage or universal health care, which, despite gestures of good intention, remains focused too highly on clinical interventions and not enough on the social determinants of health. Too focused on treatment for the prevention of mortality and not enough directed to the positive definition of health embodied in WHO's charter. Not merely the absence of disease or infirmity, but a state of complete physical, mental, and social well-being. When was the last time you heard that mentioned? It's part of the ICPD definition of reproductive health, which added in the areas of sex and reproduction. Treatment is properly seen as prevention in HIV/AIDS work, but it doesn't prevent stigma and other social barriers. Other elements of reproductive health that aren't diseases and even if they are, don't have a single, even if variously transmitted agent of contagion, are not assisted by these biases. It's to our advantage that we have, with UNFPA as a key supportive actor, partnered with others around focused efforts to ensure that protecting the most vulnerable has always been a key concern. Women, the poor, young people, marginalized groups, persons in emergency situations, and others have always been central to our thoughts. It's part of our core values and demonstrates an inbred attention to inequalities, now a hot topic in the post-2015 discussions. But we often, seeking immediate practical outcomes, work in campaign mode. Specific efforts to combat female genital cutting, mutilation, expansion of access to female condoms, reaching populations displaced or affected by civil and natural upheavals. These are among the many individualized campaigns. People in the health discussions in post-2015 were besieged by special campaign groups. Everything from cleft palate to athlete's foot, you name it, had special pleaders and organizations. These are necessary and valuable in our area to highlight particular areas of need and neglect, but they don't expand the vision of others as we would like, even while inviting partnerships with diverse communities and actors. Currently, we are properly insisting on the priority of young people as agents for change and development, and as populations of different ages and life situations with rights claims. But we must champion this within the broader development framework. Beyond compartmentalization among disciplines and institutions and reaction-based orientations, we continue to face habits of thought outside the population and reproductive health community that stubbornly persist. I spent 10 years being a primary researcher and writer for the State of World Population Report, and since have been a commentator and observer on various roles in that subsequent decade. I remain amazed that whatever the thematic content of that report, excessive columnages are given to just reporting population numbers and trends. We try to make people count in a rights-based sense, but repeatedly see reports of the numerical counts in the wrong-based sense. We've made some progress in remedying this in the area of population and environment, about which we'll hear more in later sessions today, and about which I'll say more soon. The central organizing principle of the MDGs, the linchpin of development discourse for the last decade and a half, was the reduction of extreme poverty. The development dialogue is now focused, though perhaps just aspirational, on its near-term effective elimination. Environmental sustainability is central to the Sustainable Development Goals vision. The ICPD program of action, produced in the wake of the first Rio Earth Summit, addressed environmental concerns with subtlety and nuance. And even though some of that discussion is dated, climate change was scarcely mentioned, understood, or anticipated at the time. The subtleties are there. The interactions with other concerns about consumption, production, ways of life are present, but they are so subtle that people hardly notice. Our priorities addressing sensitive issues of identity, power relations, and personal agency have often been ignored in development discussions focused on the technical application of targeted interventions. This is the backdrop of the challenge to getting the broader development policy community to consider population and reproductive health concerns. So where do we stand in the post-2015 discussions that have been a multi-ring circus of reports, meetings, e-fora, positioning statements? UNFPA has first committed to support a standalone women's goal that includes issues related to sexual and reproductive health and rights. For example, eliminating violence against women, including sexual violence, as well as other dimensions of empowerment and capability. Second, it supports a continued incorporation of universal access to reproductive health in any version of a universal health coverage goal. Third, it supports a standalone youth goal designed to spur investments in increasing the capabilities of young people, health and education, and their participation in the design, implementation, and monitoring of policies and programs. And fourth, it promotes a key component of a data revolution by ensuring that information on vital events and population trends and dynamics inform our conceptions, planning, implementation and monitoring of social policies and programs. A data revolution that, given technological advance, could well become a reality within the course of the next development agenda. The outcome of these demands remains to be seen, and difficulties in the practical arena will continue to intervene. As was noted in the satellite session at this meeting on the post-2015 development agenda, there have been hundreds of goal recommendations in the numerous parallel consultations. We have participated and partnered broadly, but not to the extent seen in the ICPD run-up itself. Major international conferences require broader efforts than just sticking your words into other people's discussions. And this is a very different historical moment than the one that preceded ICPD. We bring our legacy of our past successes in 1994, 1999, and 2005. Our emphasis on rights is both our sword and salvation and our challenge. The Right to Life movement also believes they have a rights approach, a God-endorsed rights approach, but it produces such abominations as a brain-dead body of a woman being kept marginally alive to serve as an incubator in Texas. The fight over adolescent information and services takes that problem of multiple rights claimants and extends it and poses a competition between the rights of the child and the rights of parents and other authorities. The ICPD consensus on this issue used the Convention of the Rights of the Child language about acknowledging the growing capacity of the child with ultimate priority belonging to the interests of the child. But that kind of legalistic, bureaucratic talk does not send people into the streets demanding action on support of young people. It certainly doesn't help in this regard that the United Nations formally defines people as children until they are 18 years old. While that does help people mobilize around calls for ending child marriage, it also contributes to many more debates in the political arena. Much of the momentum around adolescent rights and opportunities is of recent vintage and is more than welcome. Other language we have adopted poses additional challenges. Our development sisters at UNICEF and WHO talk about the continuum of care, but they don't talk about the succession of such continua in the experience of lived life from pre-birth to the grave. They place the start of the continuum of care at an amorphous pre-pregnancy stage. The continuum is not embedded in a continuous lifelong human striving for happiness and dignity, but is seen as a set of stations on the train delivering medical care. Attention to birth spacing as an embodied and contextualized life choice must be given its due, and it is not. The transformation we've seen from 6 or more births in a lifespan to just about a couple or less is dramatic for women, not to mention men, reducing the amount of time and proportion of life spent in pregnancy and childcare, and opening opportunities for other pursuits. Of course, without other rights, these opportunities would not be realized. Whether one sees one's grandchild first when you are 35 or when you are 60 is a profound difference in the way your life is lived and the kinds of opportunities and choices that you make. And this is scarcely adjusted. But family planning has transformed opportunity for human capacity building. Earlier research efforts and current advocacy emphasize what family planning allows. Earlier research efforts, much advocacy, emphasize what it allows, but demonstrating labor force impacts, for example, is technically challenging business. It's not so much the benefits that family planning use imposes. It is instead what opportunities its absence disposes. Together with other rights and opportunities, it transforms the world in ways that can improve us all, women and men. But as young people often remind us, the term family planning itself does not seem to relate to them. Wanting safe and satisfying sex lives, whatever your age or marital status, doesn't seem properly captured by the term. But at the same time, we must not continue to cede the word family to conservatives. We recognize that there are more kinds of families, that they all face common human challenges. Other problems in being understood by others lies with doctors, with notable exceptions like Dr. Sadiq Fathallah Sai and many others. They know, but disciplinary habits are difficult. As a community, we work well with professional societies like FIGO, the International Federation of Obstetricians and Gynecologists, natural allies who even joined the midwife movement, a medical cadre of usually women who are often professionally demeaned despite their value in uncomplicated deliveries and progressing women to higher care when needed. But we need broader alliances, even in professional circles, and need to work with and share perspectives with more specialists. Neonatologists, pediatricians, gerontologists, cognitive scientists. Early life experiences can have consequences across generations. They may not seem to be particularly relevant in poor countries and settings where the most basic medical needs are barely met and all medical cadres are in short supply. But to move policy, we need such political support, especially in middle-income and more developed countries. As technologies further develop, allowing provision of care over distances and advice over distances, even more opportunities may emerge. And we need to intensify our relations with community-based health workers, professionals, and neighbors who are active in addressing on-the-ground needs. We need to work with teachers, an avenue into schools and socialization broadly, and such work has to go beyond the issue of incorporating comprehensive sexuality education in curricula. They want to see kids who are better developed for learning, and births to women too early or after short birth intervals often result in low birth weight and medically and at times cognitively challenged children. Teachers need not expect that an inevitable portion of those they seek to teach are so afflicted. We've also made too little in forming alliances with both professionals and ordinary people of the mental health aspects of rights violations and the trade-offs of family decision-making. The mental health impacts for women, their children, and successive generations of gender-based violence and the repression of women's capabilities must be understood. Research and advocacy on this issue must be advanced. Pitfalls and debates will still arise if we move into such research and advocacy. Several problems to avoid include the evidence-challenged attention to the notion that sorry, I told you I'm not used to reading. Mental health aspects of a pitfall to be avoided is the evidence-free assertion of such things as mental health impacts of abortion and cancer promotion impacts of hormonal contraception. The opposition knows how to use the interrelation of life events to poison minds and discussions, even when such specters are largely just conjured. We should better use evidence to counter them, and we must develop the evidence more. The mental health aspects of gender-based violence and depression, and sometimes violence attending unintended pregnancies and burdened childbearing. The evidence of the shrunken time perspectives, the mental habits of being stuck in the moment, resulting from poverty, are beginning to be explored. The world of women living in poverty while childbearing is riskier, less growth promoting, and the darker than the world of those not in poverty's clutches. I'm always impressed and depressed that such exercises as the World Bank's Voices of the Poor studies don't give greater attention to sexual and reproductive health concerns. I guess people don't see unintended pregnancy as a cause of poverty. They see their inability to provide for their children, intended or not, as a signal of their poverty, not as its results. The vicious cycle then continues until information and services break it. Of course, it's also likely that the methodology of the interviewers obscure what is clear to the women themselves. They clearly can express their concerns when people like Melinda Gates listen with open ears and hearts. Giving poor women voice is essential for them and for young people. As we've heard from Kate Gilmore and others, we have to shut up and listen and give them the microphone. As we go forward, social media can give voice to many who are unheard. The triumph of ICPD was because it provided a narrative vision. It reconciled contending forces in our worldview. A rights-based view triumphed over a demographically derived economic planning mentality, because the evidence showed that people wanted more control over their lives and dignities than choices of those controlling those options would have provided them. In a similar way, the growing impact of evidence about the demographic dividend among economists is due to a change in their narrative view of the short-term economic benefits being due only to short-term trade-offs. It's the dynamics over time that affects both rights-endowed individuals and the resulting collectivities that create the potential for growth. It's part of a vision that reconciles individual-level rights and choices with the shaping and reshaping of macro processes that provide the social environment in which choices are made. Demographers are concerned with populations broken down by age and sex, as the old saw says, but the real story is about relationships between people all possessing rights and deserving respect, and how they decide where and with whom to live and when to move and maximize the quality of life that they can enjoy in whatever settings they find themselves, within the constraints that others and circumstances force on them. This is the new, broader vision that's needed, like the breakthrough vision that Cairo provided in reconciling the dichotomies in the earlier times. We talk about the need for integration, but integration is not just about service provision. It's about our mental maps. A person-centered, rights-based view of life unfolding over time, ever providing new opportunities and challenges, is a liberating one. Economists always remind us that resources are a precious commodity, and certainly financial resources are an important part of individual and societal choice. But one of the most precious commodities is time. A narrative of choices made over time can help people understand our concerns. With time central, we first need to attend to protecting the universals that hold for all time, the protection and expansion of rights. We get additional mileage from attending to critical windows through the life cycle, protection and promotion of wanted pregnancies, including ending sex-selective abortion, actions to promote early childhood development, including maternal nutrition and healthy birth spacing, addressing sexuality and gender power issues through maturations from the youngest ages and early socialization on, promoting voluntary, informed, and protected sexual debuts, responsible decision-making through individual life and family decision-making, smooth transitions to secure and ever-developing lives as we reach older ages. Both ecological trends and population trends and these characteristics share some features that keep them from obtaining priority attention by many, especially politicians. They unfold over long periods of time. Just like the poor, politicians don't think very well over long periods of time. They are, however, examples of how micro-decisions shape macro-level outcomes and vice versa. But perspectives regarding them have consequences, and lack of attention can misdirect policy decisions. As Terry Hull has written, for example, indicators over the lifespan, we need to think of capability ratios that take into account things like education is in fact work, that people don't automatically become dependent at a particular point in time, but always contribute to their societies, their families, and their own development within the limits of their capabilities. The lifelong appearance and disappearance of options are embedded in a wider context. Climate change is moving minds and hearts, if not yet pocketbooks, because of the sense that we are running out of time. Ecological sustainability is an issue that focuses the mind, but sustainability has multiple dimensions. Ecological adaptability is one, fiscal soundness is another, where returns on investments and cost savings become the center of discussion. There's also societal resilience, a social push to responsive and rights-respecting institutions. None of these is possible without exercise of sexual and reproductive rights. We are at the core of the maximization of opportunity, welfare, and dignity, and this message of ICPD must be passed on. I welcome our continued work as a community, young and old, men and women, rich and poor, to realize this vision. We haven't been persuasive enough yet, but we can still place an appreciation of sexual and reproductive health and rights in everyone's mental landscape. Be it hot or cold, wet or dry, socially stable or in turmoil, theocratic or secular, people will have sex and form relationships and deal with and shape their experience in their life consequences. We need to keep reminding them of this. Thank you.